gut medicine in the West. The good, the bad, and the downright ugly. Hello and welcome to the channel. It occurred to me the other day that we don't do gut medicine at all well in Western medicine. Now, what do I mean by that? I'll tell you. But first, a little confession. I never had the stomach for stomach and bowel medicine, gastroenterology. When it came to choosing a medical specialty to dive into, my mantra was always anything but stomach and bowel medicine. Unless at some point in my life, I lost my sense of smell. I have the utmost respect for my gastroenterology colleagues. They have a distinct professional personality. It is somewhat of an inside joke in the medical world that if you want to hide something from orthopedic surgeons, the ones who would do your hip or knee replacement operation, put it in a book. The implication being that they never read books. They are simply not the most intellectual amongst doctors. They are more the practical types. In contrast, the neurologists, brain doctors, psychiatrists, shrinks, and nephrologists, kidney doctors, are said to be the most intellectual, and they can't keep their noses out of a book. Somewhere in the middle are cardiologists, heart doctors, and gastroenterologists. And how do you distinguish between the two? Cardiologists don't have brown noses. Jokes aside, my personal heart sink moments are mostly but not exclusively to do with patients who present with tummy problems. If you're not sure what heart sink means, I describe it in this video up here. It is literally that sinking feeling you get as a doctor when you know or believe you cannot help a patient because their symptoms or illness is too complex or hopeless. But actually, I noticed that certain tummy complaints are simply Western medicine's collective heart sink problem. We just don't know what to do with tummy complaints, it seems. Now, the problem is there are certain conditions that by their very nature have non-specific symptoms. This is unfortunate for the patient because it will take months, sometimes years, before someone correctly diagnoses them and commences treatment. Finally, we call such conditions mimic conditions. They mimic other diseases, confusing the hell out of your medical team. The true diagnosis may not even be a complicated one and may be staring you in the face all along, but alas, for whatever reason, you just don't get it right. That reason may be confusing information from the patient, which sends you down the wrong alley, test results which may be incompatible with several diagnoses, or just a confusing clinical picture, meaning the disease itself is simply a very good mimic. One such mimic is the female condition of endometriosis, where the inside lining of the womb can be found outside of the womb, causing all kinds of confusing chaos for the patient and the doctors, resulting in years of suffering until someone finally puts two and two together. Imagine if you have occasional episodes of coughing up blood along with severe tummy pains and irregular periods. You will end up for sure at the door of the lung specialists at some point, who will investigate you for all kinds of rare diseases, including something called vagus granulomatosis and Goodpasture's syndrome, both of which are causes of coughing up blood, along with tuberculosis, TB, if you are of the right demographic. The crucial information necessary for a unifying and correct diagnosis for endometriosis is if the patient herself connects the dots and notices that the coughing up of blood only happens during a period and tells the doctor. Of course, some endometriosis patients who do cough up blood don't do so on every period. So there's that, a spanner in the works. So years go by without the correct diagnosis until, say, in the course of infertility treatment, someone makes the diagnosis. No doubt, endometriosis patients often end up in the clinic of gastroenterologists who correctly diagnose that their problem is not bowel-related, which is nice to know, but doesn't help the patient. Another great mimic is the illness SLE, or systemic lupus erythematosus, which affects skin, kidneys, the immune system, lungs, to name a few. Why is gut medicine particularly difficult for Western medicine? You know what they say, you are what you eat. And if what you eat doesn't quite make it to the right place where it is needed to nourish you, things get complicated for your whole body. The gut is the interface between external fuel, meaning food, and the integration into functional physiological energy sources that the body can actually use: glucose, fat, ketones, and so on. The gut is the most holistic system in the body. It has to be. It is connected to every other system in one way or another, not least because of its central position in the body. You can replace hearts, kidneys, lungs, even pancreases, but without a gut, you can only survive for a very short time, even with the highest technology. Therefore, the gut must be seen holistically for doctors or by doctors. A constant criticism of Western medicine is that it is not very holistic compared to, say, traditional Chinese medicine, TCM. So, if Western medicine is going to fail, it is often when that holistic view that is badly needed in gut medicine is ignored. Here in Switzerland, complementary medicine is quite popular. It's all the rage. It's a thing here, in a way that I never experienced in the UK. And I find their work to be very interesting, especially their investigative style when it comes to gut health. They can test for things I have never even heard of, and their holistic approach to gut health is far superior to that of Western medicine, in my opinion. Whereas Western medicine has no idea what to do with patients with leaky gut, naturopaths are the kings and queens of this. They have special laboratories that conduct all kinds of fancy tests that make my head spin and provide real answers to patients who have suffered years of strange food intolerances that Western medicine doesn't even recognize, because they are outside of lactose intolerance, gluten intolerance, and casein allergy. I once came across a patient who had suffered half of her life with the very rare problem of citric acid allergy, of which I had never even heard of. I never even knew existed. Since her childhood, she had always known to avoid oranges, lemons, and grapefruit because they would give her horrendous diarrhea. But what complicated her life was that, again, unbeknownst to me, many medications have citric acid in them, in what we call the excipient part of the medicine, which is the part that is not an active component of the medicine. It is just there as part of the medicine as a carrier molecule. What can be confusing is that several medicines can have the same excipient, and therefore You discount allergy to a particular medicine as a possible diagnosis if the patient reacts badly to so many medicines. This patient had been round the block a bit, to every gut specialist in town. Finally, someone thought to involve an allergy specialist, and careful analysis of her case pointed to citric acid in any shape or form. Right after she had had a colonoscopy, a gastroscopy, several stool tests, blood tests, ultrasound, CT scan, MRI of her gut, and breath tests. An emerging star in the world of mimics of gut problems is the illness celiac disease. Celiac disease is an autoimmune disorder where the intake of gluten leads to damage in the small intestine. Gluten is a protein found in wheat, barley, and rye, and it is prevalent in many foods. For individuals with celiac disease, consuming gluten triggers an abnormal immune response that attacks the lining of the small intestine, impairing nutrient absorption. The condition is lifelong and can manifest at any age, though it is often diagnosed in childhood or middle adulthood. The root cause of celiac disease is a combination of genetic predisposition and environmental triggers. Individuals who develop the disease often carry specific genes, particularly two genes which are called HLA-DQ2 and HLA-DQ8, which are both involved in the immune system's recognition of gluten as a harmful substance. When someone with these genetic markers consumes gluten, the immune system mounts an inappropriate response, producing antibodies that target the enzyme tissue transglutaminase, TTG. This results in inflammation and damage to the villi in the small intestine. Villi are tiny finger-like projections that absorb nutrients from food, and their destruction leads to malnutrition regardless of your food intake. So you can eat absolute huge quantities of something. If your villi are abnormal, nothing's going to get absorbed, unfortunately. The symptoms of celiac disease can vary significantly from person to person. Some individuals experience severe gastrointestinal symptoms, while others may have no symptoms at all, what's known as silent celiac disease. But if you are going to have symptoms, the most common ones are diarrhea, constipation, bloating, flatulence, abdominal pain. These symptoms are due to the malabsorption of nutrients in the damaged villi. Fatigue, weight loss, and failure to thrive. Now, failure to thrive is a particular term which relates to children and babies who fail to grow to their normal or expected height and weight because of a problem such as malabsorption. And often, celiac disease is an important cause of failure to thrive in an infant. Dermatitis herpetiformis. This is a strange skin disease, an itchy, blistering skin rash that is associated with celiac disease. While not all people with celiac disease develop this rash, those who do find it highly indicative of gluten intolerance. And if they abstain from gluten, the rash disappears. Other symptoms are headache, joint pains, even weak bones, osteoporosis, infertility as well, depression, and neurological symptoms like numbness and tingling in the limbs, hands and feet. And this is mainly due to the lack or the deficiency in vitamin B12. In the last few months, I've had a spate of celiac disease cases in adults coming through thick and fast. It's like an epidemic. The oldest newly diagnosed celiac disease patient was well over 60. He was so chuffed to finally put an end to his gut troubles that he had had to endure his whole life. Now, living gluten-free, he's well, no more brain fog, no more diarrhea at unwelcome times like in the middle of a wedding, and no more bloating. Happy times. Another celiac case that is memorable to me in recent times is of a young woman who always lamented her lack of ability to put on weight. Everybody was telling her how lucky she was to be so slim and to be able to eat anything and not put on weight. But as is often the case, these people dismissing her complaint did not know of her wretched bloatiness, chronic diarrhea, and fatigue, whose cause we had previously struggled to find. In her case, it took 3 specialists and a genetic test to finally confirm her celiac disease. Avoidance of gluten has also worked wonders for her, and now she's able to live a full life. One diagnosis I never expected to get familiar with is a special form of bowel inflammation called microscopic colitis. We have all heard of macroscopic colitis, perhaps, the 2 best known forms being Crohn's disease and ulcerative colitis. I was under the impression that microscopic colitis was rare, until that is, I had 3 of my patients in 1 month being diagnosed with it. A little research into the cases and it all became clear. All the cases were in elderly people. Microscopic colitis is a disease of the elderly. But if you have a society where an ever-growing slice consists of the elderly, then suddenly a rare disease starts to appear common. Microscopic colitis has 2 forms actually. Collagenous colitis, in which a thick layer of protein called collagen grows in the colon tissue, and lymphocytic colitis, in which white blood cells called lymphocytes increase in colon tissue. Of the 2, lymphocytic colitis is slightly more common, but they may be one and the same disease, according to some experts. Just so you know, of my 3 patients, 2 of them had lymphocytic and 1 had collagenous colitis. For simplicity's sake, I shall only concentrate on the lymphocytic type. Lymphocytic colitis is a form of microscopic colitis, a condition characterized by chronic, non-bloody diarrhea and inflammation of the colon. Unlike other types of colitis, like ulcerative colitis or Crohn's disease, lymphocytic colitis does not cause visible inflammation during a colonoscopy. The inflammation is microscopic, only detected through a biopsy of the colon tissue. It is marked by an increased number of lymphocytes, a type of white blood cell, as I mentioned previously, in the colon's lining. The exact cause of lymphocytic colitis is not fully understood, but it is believed to result from a combination of genetic, immune-related, and environmental factors, which include autoimmunity, genetic predisposition, certain medications like anti-inflammatory medications and some antidepressants, infections like the bacteria Clostridium difficile, or viruses like the norovirus, and smoking. The hallmark of lymphocytic colitis is chronic watery diarrhea without blood. Other symptoms are abdominal pain and cramps, particularly in the lower abdomen and the lower tummy area, is common during flare-ups of the condition. Urgency and fecal incontinence. People who have lymphocytic colitis tend to have an urgency about them, the need to go to the bathroom very quickly. Otherwise, they lose control of their bowel. In one of my patients, who was a fiercely independent nonagenarian in her 90s, who still lived alone and did her own shopping and everything, this symptom was the one that brought her to me. She was furious about this loss of bowel control because it made her relatives think she was starting to get demented, which was certainly not the case. She did not want to be bundled off into a home because of this, and so we made it our priority to get to the bottom of it. Excuse the pun. After weeks of step-by-step investigations, I finally convinced her to have a colonoscopy, and lo and behold, we got our diagnosis. This was, by the way, a huge lesson for me. Not all incontinence in the elderly equals dementia. Repeat 1,000 times. So remember, if grandma is suddenly getting fecally incontinent, and this is out of character for her, think lymphocytic colitis. Don't say Askadoc didn't tell you. Bloating and gas is another common symptom of lymphocytic colitis, and it's just a result of the inflammation. Weight loss and fatigue due to ongoing diarrhea. This can happen, obviously, if the condition goes untreated for a long time. Unlike other types of colitis, the symptoms of lymphocytic colitis typically fluctuate between periods of flare-ups and remission. During periods of remission, symptoms may subside, even completely, before reappearing again. Moving on, let's now talk about Sibo. Sibo is the latest kid on the block with regards to finding the diagnosis in a confusing heap of symptoms. Sibo, or small intestinal bacterial overgrowth, SIBO, refers to an abnormal increase in the population of bacteria in the small intestine, particularly types of bacteria that are more commonly found in the colon. These bacteria interfere with normal digestion and nutrient absorption, leading to a range of gastrointestinal symptoms. Sibo can occur as a result of various underlying conditions that affect the normal motility, movement, and function of the digestive tract, resulting in symptoms like diarrhea, abdominal pain and cramping, flatulence, weight loss and malnutrition, fatigue, brain fog, joint pain, skin problems, and bloating. Bloating, that's an interesting symptom. I've mentioned it a few times because it does feature in quite a number of important gastrointestinal diseases. Its causes could be as banal as overdoing it at Christmas dinner, to food intolerances, to inflammatory bowel disease. Colon cancers can also present this way. But bloating strikes a special type of fear in me when I hear it, especially from women, and especially those who also complain of weight loss, for two reasons. The first is a set of exceedingly rare hormone-related cancers called MEN cancers, multiple endocrine neoplasia. There are MEN1 and MEN2 clusters of special abdominal cancers. These are the ultimate mimics because they affect a mishmash of organs in the body. The second is ovarian cancers, especially in older women, but increasingly in younger women. The stories in the tabloid press, beginning with the words, "My GP dismissed my bloating," ... are 90% missed ovarian cancer cases, where the patient went to their doctor with a complaint of bloatiness. I have seen too many such cases to be blasé about the symptom of bloatiness. Lesson number 2 that I impart to you in this video is, therefore, not all bloatiness is due to beans. Stay healthy, and if in doubt about any health-related issue, hesitate not to ask a doc.